Hello, I'm Dr. Richard Schuldiner, low vision optometrist, founder of the International Academy of Low Vision Specialists. Macular degeneration is the leading cause of vision loss in our senior population. And many people have no idea what macular degeneration actually is. So first we begin with, well, what is the macular? If you can imagine for a moment sitting in a normal sized room and making believe that room is an eyeball. So you're now sitting in the middle of an eyeball. Well, the back half of that room, the back wall, the ceiling, the floor, and the sides, are all wallpapered with a very thin tissue. And that tissue is called the retina. It has 10 layers, very, very thin. One of those layers most people do know about. They're called the rods and the cones. So if you were able to go actually back there and examine that wallpaper, you would see little cells sticking out like rods, and you would see little ice cream cones sticking out like cones. The rods work better for night vision, the cones better for daytime vision and color. Now if you can imagine a kitchen clock in the middle of that back wall, that's about the size of an area that has only cones that are very, very closely packed in together, millions of them. And that area is called the macula. That's a part of the retina that has a specialized area of very densely packed cone cells. And if you look behind that macula, you would see that it has its own system of blood vessels back there. This is one reason why macular degeneration never causes total blindness, because there are two different blood systems, blood vessel systems, in the retina. There are two types of macular degeneration, dry and wet. In the dry type, the cone cells die. Why do they die? Well, aging, genetics, smoking, sunlight, factors we may not know about yet. How do we fix those cells? Unfortunately, we can't. We can't fix them, we can't repair them, we can't replace them, we can't grow new ones, and so the vision loss, unfortunately, is permanent. In the wet type of macular degeneration, the blood vessels behind that macular leak, and the blood spilling out causes vision loss because it kills those cone cells. The treatment for that, at this point, is an injection in the eye, which I know doesn't sound very good, but I'm told is actually not painful. And the medicine in that injection actually stops the bleeding, and sometimes stops the bleeding before it begins. And so it actually saves a lot of vision. Prior to those injections, people with wet macular degeneration had severe vision loss. And now, fortunately, that severe vision loss is limited to a moderate vision loss. Unfortunately, there is no way to cure the condition. There's no way to bring back the vision to normal. And so we need low vision devices and low vision eye doctors to help people who have macular degeneration.